Hi, thanks for joining me for another study session. Today we're going to be talking about the concept of fatigue, both mental and physical fatigue. We're going to be working in our Giddens text, chapter 29 today. You're going to be completing Concept Study Guide version B for this lesson, and we're going to be defining and describing the concept of fatigue, talking about risk factors both for populations and individuals. We're going to recognize signs and symptoms of fatigue in an individual and talk about the appropriate nursing and intercollaborative treatments and interventions that are appropriate for patients who have fatigue. But to get us started, let's just watch a 3-minute video to introduce us to this concept.
Fatigue, it is something we have all experienced at some point. Maybe you felt tired, had difficulty staying focused, lacked motivation, or maybe your eyes felt like lead and you found it hard to stay awake. But what is fatigue actually? There are many definitions, but if we really want to understand fatigue, we must differentiate between two existing types: physical fatigue and mental fatigue. With physical fatigue, your muscles feel worn down and hard to operate, while mental fatigue affects your cognitive functions. There are two types of fatigue. The two types of fatigue have different causes and must be treated accordingly. Let's take physical fatigue. The main trigger that causes it is physical exertion. Imagine running a marathon and pushing your body to its limits. Naturally, it reacts and gives you a signal to stop and recharge. Physical fatigue can also be made worse by illness, lack of appropriate nutrition, and dehydration. However, physical exertion is the main cause. To cure fatigue caused by physical exertion, you need to rest, just like an athlete. In order to keep performing at an optimal level in sports like basketball, players take frequent turns on the bench to recover before returning to the court again. So, to counter the effects of physical fatigue, ensure you take rest breaks at regular intervals. Mental fatigue, however, is triggered mainly by lack of sleep. Illness and stress might also contribute, but lack of sleep is the main cause. To cure mental fatigue, resting is not enough. What you need is a sufficient amount of good quality sleep to replenish yourself. In regards to your safety and well-being, mental fatigue typically represents a larger risk than physical fatigue. If you become physically fatigued but continue to exert yourself, you stand the risk of picking up a soft tissue injury, such as a sprain or strain. But if you become mentally fatigued, things become more dangerous, as critical activities such as driving whilst drowsy can lead to disastrous consequences. Regular mental fatigue can also decrease your well-being by reducing your energy and motivation to engage in health-promoting activities such as exercise and spending time with family and friends. To effectively manage fatigue in any organisation, therefore, it is important to prioritise addressing mental fatigue caused by lack of sleep. From a company perspective, this starts with appropriate roster design and ensuring employees have adequate breaks and free time to get the sleep they need. It may also entail providing employees with training on how to optimise the quantity and quality of sleep they obtain. From a personal perspective, it is important to use your breaks and free time appropriately by getting enough sleep and addressing sleeping problems quickly when they occur. In the event you find yourself too tired to work safely, you should immediately communicate this to your supervisor or other appropriate person. In all cases, your safety and well-being is what matters most, and this starts with making sleep a priority.
So now that we've had an introduction to this concept, let's go ahead and define and describe the concept of fatigue. So really, this concept is really about physical, emotional, or mental tiredness or exhaustion. And so fatigue can have different manifestations, whether it's physical fatigue, emotional fatigue, or mental fatigue that can hit us. Now, certainly as nursing students, we can relate to that. And in terms of the scope of this concept, fatigue is really on a continuum of having vitality and energy on one end with no fatigue to a feeling of exhaustion at the other end. Now, a little bit of fatigue in our life is a normal, expected finding. We are finite humans who have limitations. And when we push our limitations mentally, emotionally, or physically, we're going to experience fatigue. And that's okay. But when it becomes a problem is it when it persists over time or is extremely severe. Now, in typically healthy individuals, fatigue is going to be relieved by just getting some rest, either physically or mentally. Now, in terms of the cause of fatigue, it's not an exact science on what causes the human body to become fatigued, but there are some ideas about impaired calcium levels or buildup of waste products in the muscles that cause physical fatiguing. Or it could be something about neurotransmitters, increased cortisol levels, or an inflammatory response to overwhelming stress or emotions. Now, when fatigue gets out of hand and is not in control, there can be some significant consequences to someone's life, including changes in relationships, loss of jobs, increase in mental health problems like depression or suicide. And all of these things are really related to fatigue that goes on for a long time, is persistent, or is very severe. So we know that there are some dire consequences from persistent and severe fatigue. So we need to recognize the risk factors that patients would have for fatigue across populations. Now, in terms of risk factors, the older adult population are more at risk for persistent or nagging fatigue or severe fatigue, and that's just due to the physiological changes that happen with aging. Women were the other population noted at greatest risk. Oftentimes, they think it may be more of a socially acceptable thing to acknowledge fatigue for women rather than men, which may have skewed the numbers on why that becomes a risk factor. And in terms of individual risk factors, people with underlying medical conditions, thyroid disease, cancers, heart failure, are going to have underlying fatigue related to their condition, or even sometimes related to their treatment. Beta blockers, for example, which are commonly used for a number of illnesses, including hypertension, can have fatiguing kind of effects. Nutritional status and lifestyle choices, such as alcoholism and drug use, can also impact risk factors. Certainly, people with high stress jobs or who don't take enough time to rest are also going to be at risk. So, some things are preventable and some things are not modifiable if we're talking about risk factors for people. So, how do we recognize when an individual has fatigue? An assessment for fatigue isn't specific. It's more about taking a general look at the person and kind of getting an understanding of their history. So when you're asking a patient about their history, you're going to ask them about their personal description of fatigue, the onset of it and how long it's been lasting, the duration and any patterns that arise with that fatigue, and things that make that fatigue better or things that make it worse, and how that impacts their daily life. And in terms of physical examination, remember, we're looking for any underlying causes, underlying medical conditions that may be contributing to the fatigue. So we would look at things just as their general appearance. Do they appear well rested and alert? Do they seem down and tired? And then we could palpate their lymph nodes and assess for any goiter, any thyroid nodules, anything in their neck, because thyroid disorders can manifest as fatigue. And then we would also auscultate for heart tones and listen to their lungs, again, looking for any underlying conditions that could be related to the fact that the patient has fatigue today. And in terms of diagnostic testing, again, there are no specific tests to test just for fatigue, but we would be looking at diagnostic tests related to finding any underlying conditions that we might be concerned of that would be contributing to the fatigue in the first place. So let's go ahead and move right into talking about nursing and collaborative interventions that effectively manage fatigue for our patients. And as a nursing student, maybe some of these will be helpful for you too. In terms of clinical management, as a primary prevention, how do we prevent patients from suffering from persistent and severe fatigue in the first place? Well, it really is talking about maintaining a healthy lifestyle. Tips such as good nutrition and exercise, getting adequate sleep, managing stress levels, and taking vitamins to make sure you have no nutritional deficits. Now, in terms of screening, there's no population wide screening tools that we use for fatigue, but you'll really want to make sure you have an understanding of who are your patients who are at high risk for fatigue, and make sure you ask additional questions or even use a fatigue screening tool to really assess their level of fatigue and any interventions that might be needed. Now, there are a number of collaborative interventions listed on this slide. Things like managing lifestyle choices, managing disease states, and assessing medications that patients are on, and if there's something that could be better for them that may not make them as fatigued. Treating underlying causes and reducing fatigue through that way, encouraging good sleep hygiene, which we're going to talk about in our sleep lecture. Talking about exercise, it seems counterintuitive, but exercise actually helps reduce fatigue over time. Talk about nutrition and stress management, psychological care for mental health issues, and really assessing the needs and types of medications patients are on. Sometimes we can get into this rut where patients are on, they call it polypharmacy. Polypharmacy means just one medicine after another medicine after another medicine. And sometimes doctors need to kind of look at the medications that patients are on and strip away some of them to kind of clean them out a little bit, because those medications can all have their own side effects, one of which can be fatigue. So that may not be the answer for every patient, but it is something to consider. Is Are the medications that your patient is on helping them or causing adverse side effects like fatigue that we don't really want to have? Now, there are a number of interrelated concepts when we're talking about fatigue. All of these things really play into how we feel and our energy level and our vitality. Things like our nutrition and mood, our ability to function and have good cognition, our perfusion status, gas exchange, sleep, stress, and coping all interplay into this idea of fatigue. And if you think in your own life, when you've had problems or deficits in any of these concepts, things like problems with sleeping, problems with stress, problems with your mood or affect, pain, any of these things, and how they really make you feel in terms of your fatigue level, it's easy to understand how these all really interrelate. Finally, the Giddens text lists a number of featured exemplars. Things like cancer and cancer treatment can cause significant amounts of fatigue. Diabetes, mononucleosis, which is a virus that causes significant fatigue. Pregnancy and early motherhood, by the way, that also is very fatiguing. And things like chronic obstructive pulmonary disease, COPD, which is a respiratory chronic condition. These are some examples of many that can cause problems with fatigue. So consider fatigue as a concept for your patients when you're working in clinical, and to see if any of the medications they're on, the underlying conditions, or any of their social stressors at home are causing fatigue, and if there's something that you can do to help. Fatigue is a very common thing that many people struggle with. And at low levels, over short periods of time, it's a very normal physiologic issue. It only becomes a problem when it's left unbalanced and severe, or it persists over a great number of days or months. And it's those times that we want to consider what we can do for our patients to increase their vitality, get their energy back, whether it be emotionally, mentally, or physically. That's the concept of fatigue. Thanks for listening.